The idea of this study is to get an understanding of how the structure and nature of your social network influence your nutrition habits, your physical activity, and then how do social networks influence overall health and cognition of older Black adults, particularly those with multi-morbidities. Once we can kind of characterize those relationships, we're hoping that we can design an intervention that's based on social relationships to improve health behaviors and then also ultimately health outcomes such as cognitive health and other physical health outcomes. This is a really cool way to be able to get both objective and subjective measures of some of these health behaviors I'm really interested in. Like for nutrition, for example, you can ask people how they eat, but people are not great at reporting how they eat. So we'll have some objective measures using this thing called a veggie meter and then asking people, what's your physical activity like? So we'll be able to use some wearables to, objectively measure how active people are. This grant mechanism gave us the opportunity and the funds to be able to collect some of those data in conjunction with the social network information that we're getting, which is also really extensive, goes further than just saying like, hey, who are your friends? Who do you hang out with? You get to understand how those people are connected and the ways in which your social networks are connected to each other can really influence your health in different ways. For example, if you have a whole bunch of people that you're friends with, but they're not friends with each other, we call them bridging relationships. And those bridging relationships where you have the opportunity to interact with people who are different from you can be really good for things like cognitive health, which I'm particularly interested in. Getting this grant is really helpful to be able to collect this really cool and really rich data that I wouldn't have had the opportunity to otherwise. A goal of Regenstrief is to try and really amp up that health equity, get people on a more level playing field in terms of having access to health and healthcare. I think it helps build community relationships, connecting with these historically Black Catholic churches. I think it's a great thing to be able to make those connections and also connect us and these community partners with health institutions as well.